a good question. How do we communicate with parents who have concerns about vaccines? And I'm going to initially say that it's a good question because we don't have a lot of evidence on how to do that. I think fundamentally, though, what we can say are draw upon sort of the communication 101 fundamentals that we learn throughout our training in medical school, etc. Be empathetic, listen, don't multitask, sit down, eye contact. All those things I think are necessary to establishing the rapport, the trust, the empathy for that relationship to be a positive therapeutic one. Beyond that, there's emerging evidence, but still preliminary, on what else we might be able to do as providers, particularly with vaccine hesitant parents. In my work, for example, one communication strategy that I found that might be effective is how providers initiate the vaccine discussion with parents. This is an interesting idea just because we haven't really focused on that specific task before. It seems like a rather benign communication task, but I found in my early work that how we start that conversation really might predict how the parents respond and ultimately how they immunize their child. So for instance, if I start off the recommendation or start off the vaccine discussion by providing a recommendation, this is what Sally is due for today. How does that sound? Rather than an open question, how do you feel about vaccines today? What would you like to do about vaccines today? I'm much more likely to have a parent agree to the vaccines by the end of the visit than if I use that open question. So I think we're starting to understand the components that comprise a communication strategy that responds to parents' needs about answering questions, but also influences their vaccination behavior and their decision making. And how we start might be one of those communication strategies.